Hello, everyone. Thank you for joining us today. My name is Melissa Miller. I'm a medical officer in the Division of Healthcare-Associated Infections, Center for Quality Improvement and Patient Safety at the Agency for Healthcare Research and Quality. And I'm the project officer for the AHRQ Safety Program for Improving Antibiotic Use. The call today is to talk to you about participation in an acute care hospital cohort starting in December 2017. Through this project, we aim to measurably increase antibiotic stewardship activities in acute care hospitals, long-term care facilities, and ambulatory care facilities nationwide. We're excited about this program and have a lot of confidence in our team of experts in both the comprehensive unit-based safety program and antibiotic stewardship. And very excited that you guys have joined us as well today. So I will delay no further, and I will hand it over to our very capable project team. Dr. Pranita Tamma will start things off.
Hi, good afternoon and good morning to some of you. My name is Pranita Tamma. I'm a pediatric infectious diseases physician at Johns Hopkins Hospital, and I direct our antibiotic stewardship program. On this contact information for the AHRQ safety program for improving antibiotic use. And if you have any questions or need to reach me after this WebEx, please feel free to use this information. The AHRQ safety program for improving antibiotic use is a collaborative intervention funded and guided by the Agency for Healthcare Research and Quality, and it's being led by Johns Hopkins Medicine and AHRQ at the University of Chicago. And the overarching goal of the collaborative is to improve antibiotic prescribing practices and assist facilities with implementing effective antibiotic stewardship programs. And a reminder, the goals of antibiotic stewardship are to ensure that all patients requiring antibiotics receive the right dose, at the right dose and for the right duration. And antibiotic stewardship has been shown to reduce unnecessary antibiotic use, adverse events, and the emergence of antibiotic resistance. The safety program is unique because it addresses both technical aspects of prescribing, such as best practices antibiotic prescribing for common infectious disease syndromes, as well as adaptive aspects of prescribing, such as safety culture, behavior change, teamwork, and communication. And while there are gaps in prescriber knowledge about antibiotic prescribing, behavioral issues such as fear of underprescribing and not wanting to offend other prescribers are also important drivers of unnecessary antibiotic use. I'll just stop for a second because I saw a question asking if the slides will be available, and after the call we'll make sure to send slides to all participants. The program lasts for 1 year with a 3-month baseline period starting in December 2017 and 9-month intervention period starting in March 2018. And the program is free for all participating hospitals. Entire hospitals are invited to participate, but individual units within hospitals can also still participate. We believe that there are several benefits to participating. Participants will have access to antibiotic stewardship experts for coaching and troubleshooting, as well as interactive webinars, which will be held 1 to 2 times per month and cover both technical and behavioral approaches to improving antibiotic prescribing. And these webinars last from approximately 30 to 60 minutes in length, and this will be recorded and available on the project website for anybody who misses the webinar or needs a refresher. And their slides are also available on the website and can be downloaded along with a facilitator guide so that they can be adapted for local presentations as needed. Participants will have access to a variety of educational materials, including fast fact sheets and e-learning modules that summarize existing knowledge and recommendations related to antibiotic prescribing. Fast fact sheets that will be developed can be used for education on rounds or modified to facilitate development of local treatment guidelines for common infectious disease conditions. Other tools to assist with local antibiotic improvement interventions include antibiotic timeout tool, a antibiotic review form, which I'll review shortly, an identifying antibiotic defects tool, and a learning from antibiotic defects tool. And we developed educational pamphlets for patients and families, as well as commitment posters indicating that the facility is dedicated to safe antibiotic prescribing practices. And finally, materials to assist with compliance with the Joint Commission's stewardship standard, such as sample policies and healthcare worker educational materials, will be available to participants. The expected outcomes of participation include improving safety culture around antibiotic prescribing in hospitals, enhanced teamwork and communication among healthcare workers and between healthcare workers and patients and families, reduction in unnecessary antibiotic use, improved antibiotic decision-making by frontline staff, reduced Clostridium difficile infection rates, and improved compliance with the Joint Commission antimicrobial stewardship standard. The next slides will provide some additional information about the approach and content of the intervention. The overarching approach to antibiotic prescribing that will be used in the AHRQ safety program is called the 4 moments of antibiotic decision-making. Teams are asked to adopt this approach when making antibiotic prescribing decisions. The 4 moments are: moment 1, does my patient have an infection that requires antibiotics? Moment 2, have I ordered appropriate cultures before starting antibiotics, and what empiric therapy should I initiate? Moment 3, a day or more has passed, can I stop antibiotics? Can arrow therapy or change from intravenous to oral therapy? And moment 4, what duration of antibiotic therapy is needed for my patient's diagnosis? This slide lists topics covered in the webinars that address adaptive issues. Of note, with the exception of the title in green, these webinars are directed to both local stewardship leaders as well as primary teams. Thus, all participants are encouraged to call into the webinars. And the specific topics that will be included are behavioral change theory for antibiotic stewardship leaders, improving antibiotic use as a patient safety issue, improving communication and teamwork around antibiotic prescribing, identifying defects to improve antibiotic use, improving antibiotic use from learning from the defects that have been identified, and sustaining antibiotic stewardship efforts. This lists topics covered in the webinars that address technical issues. Again, with the exception of the title in green, these webinars are directed to both local stewardship leaders as well as primary teams, which really consists of frontline staff. And specific topics include antibiotic stewardship program development, stewards of asymptomatic bacteria and urinary tract infections, stewards of community-acquired lower respiratory tract conditions. So this includes community-acquired pneumonia, aspiration pneumonitis, chronic obstructive pulmonary disease exacerbations, steward of healthcare-associated and ventilator-associated pneumonia, stewardship of skin and soft tissue infections, stewardship of intra-abdominal infections, and stewardship of Clostridium difficile infections. The program complements the Center for Medicare and Medicaid's partnership for Patients Hospital Improvement Innovation Network initiative. One of the goals of the HIN initiative is to reduce Clostridium difficile rates through adoption of antibiotic stewardship. And as you see from the subjects we just discussed, the safety program is designed to help improve antibiotic use, and in addition, there's a specific emphasis on approaches to reduce Clostridium difficile laboratory ID events, as well as Clostridium difficile infections. 5 pieces of data that are requested to participate in the project. First, monthly data on days of antibiotic therapy per 1,000 days present, stratified by antibiotic type and unit. We decided to use the approach outlined in CDC's NHSN antibiotic use and resistance metric that can be found at the website shown. And we realized for some sites may have difficulty obtaining electronic data in this format, and we encourage you to contact our project team to discuss alternative options. And quarterly Clostridium difficile lab ID events per 10,000 patient days stratified by unit. These should be available via your infection prevention program, as they're required to be reported to the CDC. Third, teams are requested to complete 10 antibiotic review forms per month to identify and track improvement in antibiotic prescribing according to the 4 moments of antibiotic stewardship. These forms are completed by the stewardship team and frontline teams collaboratively. A completion guide is provided to facilitate filling out the form, which we estimate to take approximately 5 minutes. And the slide shows a picture of this form. For the beginning and the end of the project, sites will complete a 1-page form about stewardship practices and activities to assess baseline status and status at the end of the intervention. And at the beginning and end of the project, sites complete the hospital survey on patient safety to assess if there have been changes in safety culture during the intervention. Many hospitals are already requesting employees complete these surveys on an annual basis. So this slide summarizes the activity required of participating hospitals. We ask that you identify an antibiotic stewardship team. Now, we do not have an antibiotic stewardship team already defined at your institution. You can still participate, but we do request that you identify leaders who would like to be trained to assume this role, and during the course of the AHRQ safety program, we will train these individuals into being antibiotic stewardship leaders. We ask that you identify and engage frontline staff on participating units or clinical services that will participate in the AHRQ safety program. We ask you participate in monthly webinars with experts. As mentioned, we realize that busy clinicians may not always be able to make the webinars. So for the staff that are not able to make a webinar or want to listen again to what they learned, these webinars will be available on the project website. Between webinars, we ask that you identify antibiotic-related defects and identify solutions and incorporate some of the tools we teach you about into practice as you see fit. Finally, we ask that you submit the requested data to the project website. This slide shows the timeline for participation. As I mentioned before, you will receive copies of these slides. To learn more and enroll in this program, please visit our website listed here, and then you can complete the online application. If any questions you have through the process, please feel free to email us, and we'll respond to you promptly. I thank you all for your attention, and I'll open up the lines to see if there are any questions that we can help with. Thank you all again.